I'm here today with Shelley Duncan. Shelley, I just have a few questions for you. So the first thing I want to know is just tell me a little bit about yourself, what you do, your career field.
Sure. Well, I am currently the Executive Director of Central Plains Healthcare Partnership. I've been there, will be 3 months the end of October, so I'm still pretty new to the organization. Before that, I was the CEO of a much larger nonprofit called Ember Hope, and we did foster care and behavioral health. So I've worked, I have a graduate degree in clinical psychology, so I've worked in mental health, in a prison, and with the homeless. I've done a lot of different things, and so now I'm working in the healthcare field.
Very cool. So you've kind of had experience from different fields as you've gone through. That's really cool.
Yeah.
So what drew you to this specific career? Like, what drew you to public health?
Well, to this current position, actually, I was recruited for this position from an individual that I know who is actually our board chair. And my predecessor, who I actually have known for many years, she was retiring. And so he approached me about whether I would be interested in the position. And, you know, frankly, in my career, as I say, I've done a lot of different social service areas, but I had never done health. So it really sounded attractive to me. Plus, the program that we do is pretty exciting, and it provides a really wonderful service to low-income uninsured folks in Sedgwick County.
I completely agree. That's awesome.
Yeah.
So specifically, what type of projects have you helped coordinate or done within this past year?
Basically, the program that we provide is pretty much the same year after year. So we basically leverage donated health care to low-income, uninsured people that need a specialty provider. So, for example, if someone doesn't have insurance and they need a knee replacement, for example, or they need an open heart surgery, then they are referred to us, and then we work with about 650 providers in the city to help provide that care. And so we also work with all the hospitals. They provide free care. So that's pretty much what we do on a day-to-day basis. Again, I do know over the last year that we have also received funding to do patient navigation for the Affordable Care Act. And our staff are also certified counselors for the ACA, so we do help people get on the Affordable Care Act in the marketplace. And then we also help people access any other kind of public benefits that they may be eligible for.
Okay.
So, and again, I'm new. I have a lot of ideas of things I want to do, but well, talk to me in a year.
Incorporate those as they go.
Yeah.
Nice.
Yeah.
The next question I have for you is, what are your future aspirations for public health? Like you said, you have a lot of new ideas. What is one that you're specifically excited about?
Well, gosh. One is actually just a potential pilot project that we could be working with one of the large insurance companies in town that is actually one of the MCOs for privatized Medicaid, and really working with them to help better serve people that are on Medicaid in Southeast Kansas, but that really need to have specialty care. And Southeast Kansas actually has the highest poverty and the worst health outcomes of anywhere in the state. And so we're working together. This is maybe going to happen. I hope it happens. But we would be able to really connect the specialists that we work with in our network with some folks in Southeast Kansas using technology and focusing on telehealth. And at the end of the day, it would really help people, primary conditions, COPD, asthma, diabetes, and those real chronic conditions. And so, I'm really excited about trying to do something like that could really help improve the health of poor people that are living in poverty, that don't have the means to not only receive care necessarily, but also to understand how they need to manage their condition. So that's just something we're kind of working on right now that I'm excited about. I don't know if it will come to fruition because it's just real new and we're still in the planning stages.
But something like fun to keep in mind.
Yeah.
I love that.
Yeah.
For sure. what are some challenges that you've come across in public health?
Well, stay politically correct here. I think funding is always a challenge.
Yeah.
And, the other thing that I think is really important in public health, and I know that we're really looking more and more now at social determinants of health. So I think I'm really happy to see that coming about. But coming from a behavioral health background, I think one of the things that we underestimate is the role of trauma relative to many people that are seeking public health services. Because there are studies out there that show if you have early trauma, anywhere from not a lot to horrible, egregious trauma, it does affect your health later in life as well as other parts of your life. And so that, now I can't even remember what your question was, but that
There's like
the
a
barriers,
challenge.
yeah. So funding. The other thing, and I do believe we need to consider trauma, but then also just how do we get people to the door for public health? I mean, it's education about what is out there. It is how do we get people to public health? Is it a matter of transportation? I also think that sometimes there may be bias among funders sometimes about the type of individuals that are seeking public health care. And I think that can sometimes be a challenge, not always, but having worked with the population in all of my different positions, I think we have a misperception sometimes that people just choose to live in poverty and be unhealthy. And there's really a whole lot more to that. And so I would say that's another thing I think that's a challenge. I think we're doing a much, much better job of it than we used to do. But I think it's just more and more and more education and helping people that,
Helping others understand.
Yeah, exactly.
Agreed.
Exactly, yeah.
Very cool. How did you start your career? Like when you started going into it, what were the first steps you started to take?
Well, obviously, I went to graduate school.
Yes.
And really after I went to graduate school, it was just a matter of trying to find, trying to find a job, quite frankly. But I've always been committed to public work, nonprofit work, really working with those that don't always have a voice. So that's why I've kind of worked in the public sector, either through governmental positions and or in nonprofits. So that was really just a choice that I made pretty quickly after graduate school. It wasn't necessarily what I went into graduate school for. I thought I would be serving more of the private sector, but after I got my first job and worked in a maximum security prison, I knew that I needed to be in the public sector. I needed to be working with
be that voice for others.
Absolutely.
I love that.
Yeah.
That's awesome.
Yeah.
Alrighty. The next thing I have to ask you is if you had to pick one topic to shed more light on or fix, what would that exactly be? I know we've kind of touched on voices for others and whatnot, but is there anything else you can think of?
Well, I guess I go back to, again, because I'm pretty steeped in behavioral health.
Yes.
And I spoke to that in regards to public health, but I also believe it's something that we underestimate the role that it can play in a person's life, and not just trauma, but even just general mental health. I think there's still a great deal of stigma, and and I believe that health, health, physical health, and mental health are very connected.
Definitely.
And so I would say that quite frankly, that is something that I wish we could overcome, is the stigma of that, and then understanding how your mental health impacts your physical health. And again, there are studies that show that oftentimes people will show up for primary care and there's really an underlying mental health condition. And so I guess for me, because of my background, I really wish that we could get over that and get to a place where it's okay to talk about it.
I agree.
We're seeing, in Sedgwick County, the suicide rates and in Kansas have been going up. We don't talk about that. We don't really know what to do about that.
Yeah.
And, affects so many different things. So.
Yeah, getting a voice out there,
Yeah.
letting people know it's okay to talk about.
Yeah, and in the same way, it's okay to talk about public health and why that is so important to the health of a community, because you may think it's just those people, but it affects all of us, and it affects businesses, which is another thing I guess I would say that I wish businesses, particularly big corporations, would understand the importance of public health.
Definitely.
Yeah.
Nice. Very cool.
Yeah.
I guess the last question I have for you is, what's the best part of your job? What's your favorite part? What gets you going for it every day?
Well, for me, it's knowing at the end of the day that we have actually saved lives, oftentimes. And I'm, as I say, still new, but I've sat in on some of our patient intakes. And even though I know why I'm in the business I'm in and why I work in a nonprofit, when you're in administration, sometimes you get a little distance from the day-to-day and working with the people that are actually getting help. And I've sat in on a number of the appointments, and I've listened to people's stories, and I know that what we do, and I have to say also the providers, because they're giving this care away. I mean, doctors and hospitals, they're the real heroes in this, but that because of us and because of our program, we truly do save people's lives. It saves people's lives, and we also help them continue or get back into being productive citizens, because many of the people we serve, they work, but they can't afford insurance, and or they get sick and they lose their insurance. So we can help them get better, and then they can get back and be productive citizens of the community and be happier and healthier. So for me, at the end of the day, that's what it's all about.
That's amazing. Well, thank you so much for sitting down with me today. Everyone, that was Shelley Duncan.
That was easy.